similarly, when we think about brain health and mental health, when we think about preventing dementia, if there is long-term inflammation going on in somebody's brain, again, affecting a lot of the little blood vessels there, that is very difficult to reverse later. We're currently in a state where we have a number of Alzheimer's dementia treatment drugs that actually work very, very poorly and have a lot of side effects. So although somebody might think, my health is not important, I'll worry about that later, nobody wants dementia. Nobody wants that for themselves. Nobody wants that for their family members. And if you knew today that you could help work to prevent dementia by eating a healthy diet, by being physically active, that is such an easier thing to do to help avoid long-term inflammation that leads to dementia. So thinking about your health really from a holistic perspective early on makes a difference. Now, I don't want to suggest that if you're obese, you automatically have that significant of inflammation, but it is a potential association. So again, if you struggle with insulin and blood sugar metabolism, the earlier we intervene, the less time there is that your body is having increased inflammation, and the better your long-term health is going to be. When I'm talking with my patients about why we want to start making changes, we're really looking at it from that long-term health perspective. I want them to have ways of eating that feel comfortable and feel doable for the long term. Similarly, when we're adding medications, we're thinking, what is going to be something that we can do for the long term? I love medications like metformin and our GLP-1 medications like Wegovy, because they do seem to have anti-inflammatory benefits on top of their effects of treating obesity, of helping to improve insulin and blood sugar metabolism. So really thinking long-term, holistic, how can we help to keep our bodies as healthy as possible for as long as possible, regardless of what that number says on the scale? We really want to think about long-term health.